Okay, so we of course did not compare directly. As I said, radiotherapy so far hasn't demonstrated to be advantageous when combined to chemotherapy in terms of survival. So it increases local control, which is what you would expect from a local treatment, but this does not influence survival. So if you look at the LAP-07 trial, for example, that combined a form of older radiotherapy, if you wish, with systemic treatment, the overall survival was in the 15 to 16 months range. So we believe this is comparable to that, if not better. The point is that there are probably reasons why you would choose this kind of brachytherapy to get high delivery of radiation inside the tumor. And this is our phosphorus P-32 is a beta emitter, so it has a relatively short length of travel of the radiation, so does not damage the surrounding tissues. And indeed, we didn't see systemic toxicity with this kind of approach. And if the lesion is within a certain volume and has a rounded shape, the distribution of the radioactivity inside the lesion that we checked after the implantation is very even and allows you to deliver a very high dose, very concentrated to the tumor. So it might have in some lesions some advantages as compared to stereotactic body radiotherapy, while in other cases, when the lesion is not round shaped, is more infiltrating or has a higher volume, might not be convenient. So I think the way we, as a group of investigators in UK, Italy, Spain, who participated in this trial, the way we look forward to this to the next step is not exactly to compare one form of local treatment to another, but that just to make the point that depending on the lesion that you're facing, each patient might have a tailored approach using brachytherapy, external beam, cryoablation, or other forms of local control. The other point is that these patients might receive stereotactic body radiotherapy if the lesion progresses after some time. So that's, having received the implant is no contraindication to a subsequent radiation, external beam radiation. So this might be an advantage for those forms of pancreatic cancer that remain very locally aggressive, but without giving widespread metastasis.